welcome to the MLT program of Maine's social media page. Today, we're going to start having a new series where we talk to different people about different topics. And today, we thought a great topic would be interprofessional education. So, I'm Melissa, and
And I'm Nicole.
and we are both faculty for the MLT program. Today, we have with us Scott Cook, and he is going to talk with us about his experience with interprofessional education. So, Scott, welcome.
Thank you. I appreciate it. My name is Scott, and I am the simulation manager for the University of Maine at Augusta Nursing Program.
Awesome. Thank you. So, Nicole and I thought Scott would be fantastic to come on and talk about this because he's in charge of simulations and he's done a lot of IPE. And we worked with Scott when we had our own simulation with our MLT students. Nicole, do you want to share a little bit about what we did with our IPE simulation?
Sure. So this was a blood bank activity where we had our MLT students go through an emergent release activity for releasing blood components in the emergency room. So we had some of the UMA nursing staff along with Scott mock up a patient situation where we had a car crash and our students needed to work together with the nursing program to administer a unit of blood. Through that activity, we were able to get communication and conversation going through the two different disciplines and show the importance of teamwork and how all of us are part of the healthcare team and need to work together.
Absolutely. And it's great if they make the connections now. So, Scott, you were involved with this one, but you've been in a lot of other IP activities. So, what sort of IP activities have you been involved in?
Yeah, that's a great question. So prior to moving full-time to simulation, I was faculty with Southern Maine Community College with their paramedic program. And so that's kind of where I started doing education with IPE. At that time, we did a couple of different things. We did an IPE session, a very small one, with their cardiovascular program. So paramedics would learn some of the work of cardiovascular techs. So if they had an emergent MI and they were bringing it to the cath lab, what they might experience and some of the stuff that they do for tests. And this was more geared towards the ultrasound around a heart. So anyway, so that was one. We also supported one of the local hospitals when they did their disaster drill. And actually, this was kind of interesting. So our paramedic students were not actually in the role of paramedics, they were actually in the role of patients. And so this was a disaster drill at a local hospital where we ran a disaster response there. I think it was their yearly disaster response. And the paramedic students had the opportunity to play the role of patients. And in that role, they had the opportunity to see a variety of different types of professions working together in a disaster response within the hospital. And I think that experience really kind of came down to communication and what is best for the patient, for the patient continuum of care. Another experience, which was kind of interesting years ago when I was working in the Waterville area, we did an IPE session with a paramedic program, a local college with a hockey team, and a local hospital. And this was back before IPE was really becoming, more of a formalized profession or more of a formalized form of education. And we just kind of thought, well, it'd be interesting to see what would happen if we brought athletic trainers and hockey trainers and paramedics together and to do a simulation to see what happens. And it was really kind of interesting because we really learned a lot about communication and the other professions. So that's a little bit of what I've touched on in the past. I also supported, this was probably my favorite. I supported an IPE session from the simulation standpoint with athletic training at the University of Southern Maine and linguistics at the University of Southern Maine. And this was actually students from the linguistics program who were learning American Sign Language. And then we took athletic trainers who had to assess a patient who only communicated with signing through ASL. So it was really an interesting experience to really learn how athletic training students and how ASL students work together and how those two professions would communicate with a patient. And the patient was a simulated patient of a head concussion from a soccer injury, is what the patient was. So it was really kind of interesting that the athletic training students had to learn how to communicate with the interpreters, who were the ASL students who would communicate with the patient who was deaf and could only sign.
That's very interesting. I can only imagine what the students went through trying to figure out how best to communicate to a patient. So I'm sure that they had a lot of different ideas and conversations and thoughts after that activity that they didn't have prior to. So you just explained a whole variety of different activities that you've done with different professions. Were any of those scenarios very easily put together, or were there significant barriers in trying to get such a simple activity coordinated?
That is a great question, and they can become a challenge. There's a lot of dynamics in place. So I guess one of the first things that I want to touch on is when we're talking about interprofessional education or IPE, it's kind of what does that actually mean and what does that actually involve? And there's a couple of articles that I like a lot that kind of gives definitions, and I'm going to talk about those really quick. One of them was from Buring in 2009, and they quoted the Center for Advancement of Interprofessional Education, which is a group out of the UK. And in their article, they wrote, IPE involves two or more educators and learners from two or more health professions who jointly create and foster a collaborative learning environment. That's a quote directly from the opening part of their article. And then there's another article by Dr. Todorchuk, sorry, I think I pronounced his name correctly, in 2016. It's an article in the Clinical Teachers Toolbox, and he wrote with Griffith University out of the UK. And this is really interesting, they use three words for interprofessional education. So for interprofessional education, you need to have a with, a from, and an about are the three words. So with, from, and about. So example that they provide, two or more professions learn with, from, and about each other to improve collaboration and the quality of patient care. And so I think both of those definitions, it kind of really talks about what we're doing. So we're looking at IPE with patient safety, patient care, and how do professions collaborate with each other. So that's kind of a long way to get to your question. So to answer your question, I think the easy part of developing IPE is to identify who your champions are. So coming from MLT, looking at who do you interact with in the hospital, and then who are kind of the champions or who has the interest in the other professions to do stuff. That is the easy route in. So if you can get, like, in the hospital, maybe one, people from MLT and maybe people from nursing, or, some way you interact, and find that one champion, that one person that really wants to do it. That's kind of where the seed starts. And just kind of starting maybe a committee or a collaborative work group or what have you, where you meet on a regular basis. And then I think getting everybody kind of on the same page of what IPE is for that organization. What do they want to do? How do they want to move it forward? And then what are the goals and objectives of the two or more professions? Because one of the challenges I found is one profession will come in with a very long list of objectives they want to do. And another profession comes in with a very long list of objectives they want to do. And if you put those together, there is too many objectives to meet. And really, you want to keep the objectives small, maybe 1 to 3. The athletic training and ASL interprofessional event that we did, the only objective was interprofessional communication. That really was the objective. And we had one objective. So the challenges can be whittling down the objectives that people want, and what do you actually want to do. So maybe in a hospital environment, maybe you're using data from a quality team. Are there gaps? Maybe that can drive some of your objectives. The only other challenge I find is with working with multiple professions, schedules sometimes conflict, and this might be more in higher education. For instance, I'll use this as this is a fictitious example, but nursing might have clinicals on a couple of days, and MLT may have clinicals and labs on a couple more days, and the days do not line up to try to do an event or to try to. So you may, bring this all together, and then all of a sudden realize, well, these students are here, and we now need to coordinate schedules. So in a nutshell, the easy part, finding your champions who has the same interests, who wants to work with you, getting everybody kind of on the same page together. And then some challenges can be, what are your objectives? What are your goals? How do you want to do this? And sometimes just time and schedule.
That's great advice. What do you think about for if like nursing or MLS, if there are online programs? For any ideas for like interprofessional education with the online programs?
So interesting you ask. The AT and the ASL program that I supported at the University of Southern Maine, I worked with a faculty member in athletic training who loves interprofessional education, and another faculty member in linguistics who was very interested in interprofessional education. We got it all together, and COVID came along. So we all of a sudden had to move the whole thing to Zoom, and we had not run it yet. So we actually did it online. So we actually did it through Zoom, and we just used the Zoom rooms to support them. And we would put like the students, instead of them having the Zoom waiting room, we actually created a room for them so they could kind of interact together. So when they would come in, we put them into a Zoom room, which was the waiting room. And then that is where some of the pre-brief and some of the information would have come from faculty. And then we would take those who are, so I think we had 3 or 4 AT students, 3 or 4 ASL students, and we would bring them into the room. We would have everybody else turn their cameras off, and we would instruct the students how to hide non-video participants in Zoom. So you wouldn't have this really busy screen. So really what it was is the 2 athletic training students, the 2 ASL students, the simulated patient. We actually had a person who played the patient who knew sign language. All the other cameras were off, so it was very easy to work in and around. And then when we were done, then we moved everybody to another room for debriefing, and we had everybody turn the video cameras back on, and we did a full debrief. So we just kind of embraced the technology that was there. And that's how we did it online. The one thing to do something online is to have, if you're going to do something like that, is I would recommend having some pre-course material, maybe a little bit of, an article to read, or maybe a couple articles to read on maybe what is interprofessional education, so maybe the learners understand what they're getting into. Maybe an activity, or some education, just so they're kind of preparing. Because really, you want them to feel comfortable working with another profession. What is the importance of that profession? How does it come into patient care? How do you communicate? Bringing all those components into that. So I think definitely a little bit of pre-course work ahead of time. And then if you were going to do it a live session, do it on Zoom. Yeah.
What about a session that's not live?
That is a good question. And I don't think a session that is not live and interprofessional, that is a really good question. Maybe if there's a way to create a scenario with maybe a video,
Hmm.
and then maybe if you set up dates of when students had to interact. So are you talking totally asynchronous? Yeah. Maybe set up discussions or some sort of interaction. I guess the nut to crack would be how would the student interact and how would the student work between each other in a true interprofessional type format versus if you bring in multiple students into a classroom and you kind of lecture at all those students on the same topic, that's not necessarily just because of different professions. It doesn't mean it's interprofessional. It's really kind of like a multi, I guess, professional. So really, it's kind of how do you get those team dynamics and how do you get that communication to work in an asynchronous environment? That is something I don't have the answer for right now. I would have to think about that. I don't think I've ever done an asynchronous in a professional event.
I don't
Good,
know
good
how
question. Good question.
I don't know
Good
how
question.
many have been done, but just thinking, more programs are moving, it may be beneficial because if you're thinking fully asynchronous, they're in their own courses within the LMS, so it's not like they
Right.
can actively communicate easily unless you
Right.
create like a separate course within the LMS and call it like IPE. And then you load all of the whoever, the MLT and the nursing students into there. And then you can have them interact through that. When you were talking, that's what I was thinking about is using like a separate, because we create like, so MLT, we have a cohort page and
Hmm.
like a whole class has access to it and it's got program information and whatnot. This way we don't have to house it within like the didactic courses. So it could be a page like that where you create it and it's IPE and you load all the students in and then perform your activities there. You could use discussion boards because then they'll all have access to the same course within the LMS.
Yeah. 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 I think it's a great thought. I guess my only question is the kind of the live interaction communication that occurs, with a
Yeah.
synchronous based format. Um, I guess I'm kind of wondering how that piece would play out and how they would get what I guess my question is, there's got to be a way, but how would the learner understand, like, how does this other profession interact? Like, I've called for these orders, so an
Mhm.
emergent transfusion, I've called for this, and then when it arrives, but like, how does that interact and how does
Mm.
that flow go? That's a really good question. So love to
Something to
see
think
some.
about.
Yeah, yeah, absolutely, absolutely.
Well, thank you for entertaining my
Yeah,
hypothetical.
no, absolutely. Yeah, I know that would be a good. I would probably hit the library journal pages and start searching and see if other people have done it. That's where I always start. I always start at a journal page. I always start in the library journal search and see what I find for stuff before when I come up with new ideas. And sometimes people have done it.
That's a good point.
Yeah.
Yeah.
And it's required by our external accrediting agency now for laboratory sciences programs, and there are some fully online programs, so it'd be interesting to know if anybody has done anything fully online yet.
Yep. Yep. I think that would be a great search for interprofessional education and asynchronous. Maybe those two keywords are too broad, but maybe you can narrow it down or something in the library can help you narrow it down. Yep. Absolutely.
Scott, we really, really appreciate everything that you did to help coordinate the MLT students with the nursing students. When you and I first discussed this, we talked about the importance of IPE after the educational experience and into the workforce. Can you talk a little bit about how this relates to these students when they move into their permanent roles?
So I think it's very important for the students to um, understand that there are other professions that they're going to be working with. And I think students all understand that. I think one of the things that we have done, and I'm saying we as a whole throughout, we as a healthcare education industry have done, is we get really caught up in our own education with our own students. And so we prepare them. For instance, when I was teaching paramedic students, um, myself and our faculty group, we did a phenomenal job with educating our paramedics and our EMTs, and they did great on the pass rates, and they did wonderful, and they would move out into the field. As I look back on that now, I look at they could have benefited more if we did some IPE with nursing, with labs, with respiratory therapy, with cardiac cath lab, how. And so I think healthcare as a whole, like I said, we get so wrapped up in what we want to teach that we forget about what they're going to actually experience when they go into the workforce. And it's not that they're not prepared, because they are prepared, but it's they're now going to be working with these other groups. So I think IPE is very, very important from when they hit the ground and enter a program to start experience other professions. Some places are now talking about they try to run IPE throughout the whole time their students are there. And I'm not saying every week, but maybe each semester that they kind of run it so students are, it becomes more of a norm for them. So when they go into the workplace, as you asked, Nicole, then they are familiar with, I'm going to be doing this interaction with nursing. I'm going to be doing this interaction with physicians. I'm going to be doing this interaction with, respiratory therapy. So they kind of get this larger view of whatever profession they go into, how that profession is going to interact with, let's say, their clinical environment. How are they going to interact with others around the clinics? And I am as at fault as many other health professions. Like I said, when I was teaching paramedics full time, I did not do a great job. And I think probably IP was building at that time. It was not required in many accreditations at all. It is becoming required in a lot now, which is good. And I think it's good just for that reason, is to get the students prepared so they understand. Because I mean, really, at the end of the day, what are we doing? We want to give the patients the best care in the safest way possible. And I think kind of the training in our own little worlds and just sending them out, we kind of missed a lot of these other places that could be working.
I think for us too, being in the lab, we are always behind the scenes. A lot of times we're not out and about. And with our students, I heard, because we talk a lot about our own experiences as instructors to try and bring that in. But until the students see and hear, they can't feel it. And all of our students really appreciated the conversations with the nursing faculty and students to reinforce what we've told them as instructors, to say, this really does happen, or this is how I would feel in this situation, or how I would respond in this situation. It was very, very well done, and the students benefited from it greatly.
And I think going back to the one that you had set up, I think an emergent transfusion was wonderful, because your students got to experience, when they walked in, that environment in a simulated ER setting, of the noises, the stress level, how quickly people want things done, and how all of that's going to work. And even though lab is behind the scenes, you're behind the scenes, but you're a key component of supporting what everybody's trying to do. And you are within the patient spaces. So you're not always behind the scenes. And I think it's very important for a student to understand, maybe not day one of the course, no, maybe not day one of their job, and all of a sudden they have to go to, and they're in a small hospital, and they all of a sudden have to go to an ER for emergent transfusion. They have no idea what they're getting into. I thought it was wonderful how you set that up, and I thought it was great because they got a little taste of what it's like um, in a situation like that.
One thing specifically that the students mentioned was what you said to them prior to was, we're all here for the same reason and we're here to learn. So treat this as, can
Yeah.
you repeat what you explained to the students to make them comfortable in the situation and sort of set the precedence?
Yeah, so I talked to them about when they come to the lab that we are basically, it's a basic assumption. So we are assuming that everybody there is knowledgeable, they care about what they're doing, and they're going to do their best, and they're here to learn. And we wanted to make it a safe environment for them. Um, if you go on to the Center for Medical Simulations website, they have a very nice basic assumption written out on their website that can be used, and basically that is what it's saying. It's recognizing and kind of leveling the playing field. I look at it when I was teaching, I always looked at it as I would learn stuff in the classroom just as much as the students would. And sometimes the students wouldn't know that. Sometimes I would tell them that. I would say, thank you very much. I learned something new. So I think that's very important. I also think it's very important because students are nervous. I think it's important to acknowledge that they're adult learners and they are bringing information and knowledge with them. And that is wonderful. So some maybe are working in a hospital already, maybe they're in a doctor's office, and that is wonderful. And I think part of this experience is we are recognizing that they have that information, but we're bringing them new information. So we're kind of bringing them up to the edge of their comfort zone, to a zone where they're maybe uncomfortable. But I used to tell the students that's okay, because that uncomfortable feeling is you learning. And that is why we're here. And if I make it super easy so you can just jump for it and just go home and you didn't feel uncomfortable, then I probably didn't do my job, if that makes sense.
That's a great point. Thank you. And it's great to when the students feel comfortable, they're going to do more and they're going to learn a lot more. So that's a great way to start out the activity.
Yeah, absolutely.
I was thinking about something that you had said where some programs are putting in these IPE activities from the beginning. I'm just wondering, like in the beginning of a program, how would you, when the students know nothing really about nursing or MLT or anything really, how would you put in an IPE activity? Does it have
Yeah,
to be medically related?
yeah, so I have not done this myself, but I have heard and I have seen that some people will just do an IPE activity that is not medically related. That's just kind of getting people to work together as a
Mm.
group. There was one I sat in on I was at a simulation conference. This was pre-COVID, and I sat in on a IPE session for about an hour and a half, and it was really kind of interesting how they set it up. So everybody walked into this session. They were giving us numbers at the door, and we had to sit at that table, whatever number we got. So it was kind of mixing us up, is what it was. And then all around the room, they had um, stations, chairs, stuff set up with like one piece of medical equipment from various professions. And so what you had to do was with your group, and this was kind of a game that everybody did together to see who could solve the puzzle first. With your group, you had to go to each one of the stations, identify the piece of medical equipment, write that name down, and then there was this word puzzle where you plugged all the words in, and it would develop, you'd find the hidden word within the word. And so what it did was it brought people um, like for instance, my group, I had a physician, myself was a prior paramedic. We had somebody from osteopathic, maybe, I think. I can't remember. But anyways, And so there were some things I never saw before. I had no idea what they were, but somebody else in the group did. And so so it was really kind of interesting. We just kind of moved around. Now you do have to have a little bit of medical knowledge, but maybe early in a program, if they've got like just a little bit, you could create some kind of game. And what I did was I ended up learning some pieces or medical equipment that other professions use, and they kind of talked about it. Now we didn't actually do a simulation, so I don't know if it was like a true IPE type event, but it was definitely, we were interacting with other professions and learning from them, and we were working with them. So, and it was a really nice kind of icebreaker before the session. And then we had, I think, 45-minute session afterwards. So yeah, it was great.
That's
So maybe something like
fantastic.
that. I mean, maybe
Yeah.
some kind of game that they can,
Yeah.
think about the professions, and maybe, I mean, when I say at the beginning of the program, it may not be semester one, because you're right, they may not have enough information,
Mm.
but I think some places wait until the students kind of have all the information they need, and then like towards their last year or last semester, maybe last 2 semesters, that's when the IP gets brought in.
Mm.
And I guess some of it is now saying, well, can you think about trying it earlier?
Mm.
And you're right, maybe a game, maybe it doesn't have to be medically related, or
Yeah.
maybe just based on their profession, but something very superficial.
Well, when you were talking about that game, I was thinking even like just throwing them into a scenario where they have to communicate, like one of those breakout rooms, right? It's not medically related whatsoever, but it's all about effectively communicating with everybody to get out.
Right. Yep. Yep. And to even get them to start communicating with people who they don't understand,
Hmm.
or they've never met, or profession they've never worked with, just to start to get that communication between other professions.
Mm.
I think, and this is not research at all, but I think you start that communication at the ground level. A semester or two down the road, they're going to be accustomed to talking with other professions, and then you do start bringing them into more of a interprofessional type setup.
The other thing with like the beginning of the program, you could always think about even providing like activities to them that could just benefit them academically. So like if you
Mm,
put them into classes or like a workshop together for like this is how you effectively use a textbook, or this is how you take notes, this is how you should listen, this is how you should study. I think even something like that, it's not an IPE, but like if
right.
you're putting nursing and MLT students together and you're forcing them to work in groups to better their academic skills, something like that might be beneficial early on, both academically and starting that interprofessional just communication.
Absolutely. Yeah. Yeah. I mean, I'm all about building bridges and communication, and how does that benefit the patient? Absolutely.
So now that you've been involved in an IP activity with MLT students, are there any thoughts or ideas of other types of activities that would be appropriate for this group of students?
Yes. Well, so I think I think you're off on the right foot with IP. I think you did a great job. You reached out. You definitely identified a group that you're going to be connected with and you're going to be working with in the hospital. Um, I would say look at, whenever I think about IP, I always look at who who will the learner interact with when they go to work. So who are they going to be um, getting requests from? Who will they be working with? Um, because it doesn't only benefit like MLT, but maybe if there is somebody who does the communication for the orders, like maybe it's an assistant on a floor, and maybe it is a program that teaches medical office skills, or something like that. I always kind of look at it as just kind of like thinking outside the box, and then what does it do? When I was at the University of Southern Maine, when I learned about the linguistics program, which I didn't even know there was a linguistics program, I went to my colleague in athletic training who loved IP and simulation, and I said to her, I'm like, wouldn't it be cool if we just did an IPE with linguistics and American Sign ASL students? And she said, yeah, that would. And that's how it started. It was just like, this would be really cool. It would be kind of interesting to get the students. And I'll tell you, the very first session we did on Zoom, an athletic training student during the debrief, she said this one 20-minute, 15, 20-minute session just changed her whole perspective on patients. And she said, I've always thought of patients, because I'm an athletic training student, as healthy and fit and athletic and stuff. And she goes, and I never considered communication barriers ever. And she goes, this just changed my whole outlook. That right there, that one comment right there made that whole thing worth it. And we ran it for 2 weeks. But by her saying that, we did our job, and that's what we wanted to do. So I would just say, just kind of look around and think outside the box. Do you have difficult patients? We have social work and mental health here on campus. Is there times where you might have patients that, may have challenges understanding why you are there or why you need to? Is there a pediatric population or a pediatric group that you can work with, working with or interacting with the providers who take care of pediatric patients? Because I'm sure you probably do education on drawing and labs on pediatric patients, but then there's like the interaction with other healthcare providers, that specialize in pediatrics. So I always kind of look at it as, what do I do? What does my environment touch? And even kind of like I said, the AT-ASL thing was just like, hey, this would be kind of interesting to do this. That's all it was. That's how it started. And it was just me and this one person from athletic training who both love simulation and IP. That's how it started. It was simple as that. So yeah, that's all you got to do is just look for a champion, look for somebody who loves it like you do, and just look at who you touch for professions. Just kind of think outside the box.
Awesome. Well, Scott, we really appreciate you taking the time to meet with us and to share your experience, especially where this is now a required thing. A lot of medical lab programs are going to be thinking about this, and so having some ideas,
Yeah.
guidance is really, really helpful. So we appreciate your time.
Yeah. Well, thank you very much. I appreciate the opportunity to talk with you.
We look forward to working with you in the future.
Yes, I look forward to working with you folks as well. It's very exciting.
And everybody
Thank you.
else, thanks for
Yes.
listening.
Yeah.